Today, Friday, March 8th, is International Women's Day. The theme this year in 2024 is Invest in Women, Accelerate Progress. Warrior, I have the perfect guest joining us today. She exemplifies women empowerment and accelerating progress in both her business and her personal life. Dr. Maria Sokolina joins us. Welcome, Dr. Sokolina.
This is such a generous introduction. Thank you very much, Lynn. I'm so honored to be here.
Well, I didn't even start yet because I want to tell our listeners a little bit about you. You are proudly serving patients as a dentist. We're going to get into all of this in New Jersey and New York. You are a board certified dentist by the American Academy of Dental Sleep Medicine. You have made so many people beautiful, including myself, by, repairing teeth. Let's just get into it. Repairing teeth, dental implants, cosmetic dentistry. You are a leading dentist in the state of New Jersey and New York. And you have received so many awards and recognition due to your mastery of orthodontics. And you strive. What I love about you, Dr. Sokolina, is you become our friend. You become, we have a relationship. It's more, I actually look forward to going to the dentist, something I never thought I would ever say in my entire life, and you were awarded a top dentist rating by Healthy Living Magazine. And you're a proud person. And so I think one of your best qualities, again, is you develop a personal relationship which comforts one when they're coming into get their teeth cleaned or get their teeth fixed, because it's not an easy thing. The website is harmonydentalarts.com. Everyone, I urge you, not now when we're completely done, to go to harmonydentalarts.com. Dr. Sokolina, welcome to the Warriors. I know you have a busy schedule. Thank you for joining me today.
Absolutely. That's, you put it so well in a lot of things. Yes. I really enjoy my relationship with my patients. And I think that's a key. Trust is a key. And I know everybody, they feel not like obligated, but almost every other patient mentioned to me how scared they are going to the dentist. But I don't think what dentistry is that medieval torture chamber. It's not true in reality. But I understand when you come to the dentist, you're new to the dentist new to you, and it might not be easy thing as any other encounter with a new person. But in the same time, dentists want to help, dentists want to make it better. And I think those relationships, they make the collaboration, the taste of collaboration totally different. So I encourage your listeners.
Yes, you do. You just make it so comfortable. Something I certainly, I used to think I'd rather be in childbirth than go to the dentist. Now that's kind of a big, a big jump, but you know what? You make it fantastic. I want to, you're a woman business owner. I call you a warrior. Let's start with, what do you want to tell us about yourself? Whether it's your childhood, whether it's your education, share with us a little bit about who is Dr. Maria Sokolina.
Actually, thank you very much for giving me the questions in advance, because you gave me a chance to think about them. And I was thinking about several words, what I would characterize myself. I would put it, I'm a woman. Yes, I like to be feminine and all these woman qualities. I really enjoy them since the early childhood. But also, I consider myself a scientist, a really curious person, and I would like to explore different areas of human life. I was talking about culture and the history and relationships, and I like the good stories. And I really enjoy my field. I really enjoy healing people, find solutions to make them feel better, look better. And I'm a storyteller. I like to tell a good story. So as of now, when I was in childhood, I always thought how I'm going to turn out, how I'm going to be the adult. It was such a scary thing to look at the future, because I didn't know if I kind of knew I have wings, but I didn't know where to fly and why to fly. Like, I had so many questions, which make me anxious at night. And I know a lot of your listeners, warriors like me, probably have the same emotions, but I recommend them not to worry because life very often give you the answer. You just have to look for an answer. You have to open your eyes or be brave and find the answers, purpose, and it make it much easier to fly. So that's and if I tell you long version of the story, yes, I'm from Soviet Union. I moved to United States as adult after I finished my first medical school in Russia, and then I went to NYU College of Dentistry to have my second medical education. And some people say, "Oh my God, you have to do it twice." Sometimes people feel upset to do it even once. But I enjoyed twice. It was totally different flavors. Look on the science from different perspective. It was totally different education. I learned totally different things. Uh, and then I work in a hospital. I thought I enjoy hospital dentistry, but probably it's not so much. And then I started working towards my private practice. I was working a little bit for somebody, and then I really want to be business owner. I wanted to be from early childhood, and being from Soviet Union, or the time when I was in Soviet Union, private business was not. It was actually kind of a criminal thing. My uncle ended up in jail for that. But I really want to have a business. I thought dentistry is the profession what give you that type of freedom. And yes, and I started my own business many years ago in New Jersey, and then I opened another location in Manhattan. But on a pathway, I find dentistry as a profession, a really diverse profession, would give you opportunity for creativity and constant growth because you can learn something and then you can use it and then you can see the long-term result due to longevity of relationship with the patients. So it's all very exciting. People look at our profession with totally wrong eyes. I would put it that way. But being creative and curious person, I create a channel on YouTube and Facebook where I'm trying to put as dentist and the totally different life. And I'm doing that in a sense of dental sleep medicine, but not only. I interview professionals from different areas, and I'm trying to figure out how to connect medicine and dentistry.
I love
Because
that.
a lot of us are great scientists, and a lot of us wants to revolutionize a modern state of medicine. How global it sounds, but it's
Hmm. You said so much. I have so many questions for you. I was going to say to you, you mentioned the word science a few times. Scientist. I like that. I don't think people associate like dentistry with science. I think science is something also for our children, our young people, that we have to encourage them, to go into this field because you pointed out. I was going to say to you, why did you pick becoming a doctor in dentistry? There's so many different fields you could be a doctor in and help people, but you picked dentistry. And I actually always wonder to myself, really, why do you want to look in people's mouths? Why do you want to fix, teeth? But you explained it very well the way you explained it. I don't see, tell me about the landscape of dentistry right now. Is there a push at all in any schools towards this field? Because we're going to open up and speak about everything else you do. We're not just talking about filling cavities, as you started to explain the sleep apnea, which is happening, and a lot of other things. Even I want to touch even going into Botox, even the mouth exercises you were explaining to me one time when I was in the office. But why in particular? Do you think they push this in schools? What do we know about the landscape in schools? Because I don't really hear much about dentistry, like in the education field, as a you might because you're in the field, but the public. What are your thoughts on all of this?
I want to ask you a specific thing. You want to know about landscape in dental schools, or you want to know how dentistry as a profession presented in the public schools? I just want to, specify what exactly you want me to touch base on?
Well, first of all, you can talk about anything you want to. So um, that's how it goes on the Warriors channel. But also, just the landscape of, is dentistry being introduced as a profession, as a whole? I mean, I went to
Mhm,
school years ago, but it was always introducing teachers and
mhm.
fire women.
Yeah.
And so what about dentistry? Because I love the idea of um, programs of STEAM, the science,
Mhm,
technology,
mhm,
engineering.
mhm,
I put A in it for arts and then
mhm,
mathematics. I call it STEAM, not STEM. What
mhm.
is the education, the landscape out there for young people?
Personally about dentistry, what I know, what I present to the schools, my two boys went to. I did the programs about dentistry. We had a professional development day, I would call it. It was more like a fair where people, I would give a little presentation about my profession to the 7, 8, 9 graders, what they can kind of spark the interest towards the field. But in a way, I presented that as a mouth being part of the human body. But what is actually the truth, what dentists who spend most of the time with dental hygiene, as well as dental hygienists, with the patient, they can see beginning of a lot of pathology, beginning of a lot of disease. And I try to present it that way to the middle schoolers. What you are really a scientist, uh, human body, I would say,
Yeah.
because you have opportunity to see a beginning of, mm, I would say, you can educate patients about cardiovascular disease based on the landscape you see in the mouth. You can talk about different situations with the posture because very often you see how patient can or cannot sit in a chair. Certain situation with the neck and the shoulders, and you can explain. And of course, my favorite topic, dental sleep medicine, you can explain a lot problems with the breathing. That's exactly the area where you can see if somebody's breathing with the mouth or the nose is blocked and they have a sinus infections. So a lot of beginning, I don't want to be very medical on your channel, but as a people who are curious about human body, dentistry is a great field. And that's how I try to present it to the school kids. It's really hard for me to paint the whole landscape about presenting this profession in school, but I noticed what not many people were interested in my profession. Of course, dental school is a great field, and it's really hard to get into dental school because after college, people become a little bit more practical and they realize um, financial rewards
Right.
in our field or autonomy, I would put it that way. But I think to survive in our field, because we really have to have a lot of mental power to deal with a lot of, I would say, with a cascade of problems what we deal on everyday basis, you really have to love.
Mm. I mean, I just think it's incredible your journey,
Mhm,
what you're
mhm,
sharing with us, but also what I know about you. I
mhm,
Let me ask you, how on this International Women's Day, how did you do all of this? You obviously started you had small children when you were
mhm.
branching out and all of this. And how did you handle that balance? Because I come from, when I was growing up, and I'm older than you are, but it's like, oh, women can have it all. You know, I you can't, but you can sort of fit everything in. And I look at you always and see what a great job you're doing with all. So explain how that was. How were you, wife, mother, and building this business? How did that work for you?
Number one, I have to say big thank you to my partner, Mike, who really helped me on a lot of points, on a lot of steps of this journey. And I have a great family. I have a support from both sides of the parents. That's true. But also, juggling would be great word, and balance would be the great word. You have to kind of create balance inside your head and make a really, structured path.
Right.
Uh, But in the same time, as I mentioned, I have a very strong feminine um, beginning. I always want to be a mom. I want to have kids. And when it's kind of in my life coincide uh, in the same time. I moved to United States. I was already adult, and I have to get the education. And I didn't want to wait to become a business owner as well. And I want to have kids, and it's all kind of happened in the same time. I purchased the business when my son was 5 months old.
Oh.
Yeah, it was a situation because I wanted to go to the graduate program, but it did not happen when I was pregnant or just gave birth. It happened. Then, I didn't want to wait, and I have to do what I have to do. But I would like to encourage your listeners. You just have to have a strong desire and plan well, and
Keep
it's not
going.
so keep
Just
going.
keep going, one foot in front of the other, correct?
Yes, absolutely. You
That's
have
it.
to look at if you start looking at the distant future,
Yeah.
it can create a lot of anxiety. It's very easy to say to live in the present moment. It's really hard to do. But I encourage people, that question I get quite often, how did you do that? I said, it's all possible. It's possible. You just do it. If you have a desire, you do it.
Yeah. I think, Dr. Sokolina, I always suggest to women just, one day at a time, kind of thing, because when you look at the big picture, many get so overwhelmed they shut down. They don't do anything because they can't handle, and they get anxious. If we just take it a step at a time, a day at a time. But you also pointed out before you had support, and I think for women it is very important to have some source of support. Now, not everybody has family, but if you can have a couple of good friends, if you can count them on one hand, anywhere where we don't isolate, we have support. And also, we should be very aware. I'm very getting very tough about this in 2024. We as women also need to cheerlead, support other women, and remind them, even if it's just a little message. How are you doing today? And mean it. Just little steps to give that empowerment, because people seem to really be again overwhelmed and suffering these days. I love your infectious energy. That's what I always think of because you're passionate, and it makes me more passionate then about everything I do. Um, I want to ask you, let's talk about some of the services you do in your office, because myofunctional therapy. Now, I know before you said you didn't want to get too medical, but I kind of want you to, because I want people to understand a couple of things, and things you offer and you do, and why, if they live in New Jersey, New York, I don't care. They should fly in on airplanes to go see you. What you do. And you have a brand new office, a beautiful brand new office that I was to recently, right here, West 57th Street, everybody, 119 West 57th Street, a suite of beautiful offices. So tell us about whatever you want to tell us about the practice and what you do offer.
I main, I would say, main stream right now, what I'm trying to do, I'm trying to promote dental sleep medicine to other dentists. I don't want to be too statistical, but 20% of our population have some sort of sleep and breathing disorders, and 87% of them are undiagnosed or maybe untreated. Not so much undiagnosed, maybe they know they have that disease, but due to the present state of medicine, they offer only CPAP machine. But that's not the only treatment for that particular disease. It just happened to be that way, and this is my mission to fight with that statement, I would say. Because there are some other treatments, and they not less effective. They're just not offered by general medicine for a lot of reasons, and I always talk about that on my channel, sleep apnea, snoring, breathing health. And now, yes, that's my main focus. Yes, we do other type of dentistry, but I always want to focus on the general state of health for the patients, and we ask them about the breathing and about the snoring, and you ask about myofunctional therapy. Is one of the, it's a broad term, but it's one of the chapters I offer for treatment of obstructive sleep apnea. And I look at the dentistry, at the different disease, periodontal disease or any broken teeth, which is also, quite often I encounter in my practice, as not as a singular element, like this is the event, but I'm trying to look with the scientist's eye and find the connection. Why is that? Why patients have that condition? And very often the answer lies in sleep and breathing disorders. For whatever reason, people cannot breathe how originally we were designed to breathe. We're not formed in the right way due to the food we eating, due to the muscle habits we learn or we develop due to the lack of the breastfeeding, due to the food what's supplied in the bag, due to all the food being mashed up and we not chewing. So there are a lot of factors, but as a scientist and a dentist, I see the result of it in a patient. Wow. And to find that connections, I call it route to roots. I find it very exciting. That's why I really like this profession. Not only I treat the cavity, I try to explain to the patient what they can do not to develop it in the future. Or if they have a bleeding gum, how strategically we can plan it, but not to have a bleeding gum for the rest of the life, because it's actually entrance to the human body. So things like that. And myofunctional therapy, going back to the beginning of the question, come very handy, because with that type of therapy, we teach people the basic principles. We teach them how to breathe. We teach them how to hold the lips actually together, and how to hold the teeth actually apart, and where to keep the tongue for the rest of the day. Because if you keep it on the roof of the mouth, you stimulate your parasympathetic nervous system, and actually from anxious state, you become calm. All of that being said, and we teach them how to eat the food. Things what we take for granted, we try to change, and we try to make it to the better. I know my word sounds so revolutionary or strange to a lot of your listeners, but as a dentist, we see the other end. We see the pathology, we see the broken teeth and bleeding gums, and a lot of problems with TMJ. I can not reverse, but I can teach the different way to look at those pathologies. And I find it my mission, and I feel very encouraged and inspired by them.
I love that, because again, that goes back, no pun intended, when I say like a root cause of a problem, as opposed to you're putting a Band-Aid, on a problem with the mouth. You're going back, you're investigating, you're explaining to that patient what's going on, or you're explaining something, to intervene for something not to happen. I think, and again, I'm not a dentist, every house I go into, Dr. Sokolina, I think they have one of these sleep apnea machines. I see them nonstop, like in bedrooms and bathrooms. And I think to myself, is this like a money-making thing? How all of a sudden in the last few years does everybody have this sleep apnea? We have to follow what you do and get to the, causes, the root causes of why somebody maybe has this problem. I think you'll agree with that, correct?
I agree with that, but it's not a money-making thing. It's a disease of evolution. Yes, it's quite new field in medicine. I would give it 20 years. It's quite new, but it's very visible how we see the effect on cardiovascular health, on a brain health, connection with Alzheimer and Parkinson's, connection with atrial fibrillation. I recently published an article, but I always give that statistics to my patients through my sleep apnea practice. 30% of my patients, and it's true, I see that every day, have atrial fibrillation. But from atrial fibrillation patients, 70% of them have a sleep apnea. So it's such a reciprocal relationship between those two diseases. And very often people get treated for atrial fibrillation, if we're talking deeply medical, with ablation. So somebody touching the heart with a laser or different frequencies, actually touching the heart, very valuable organ of the body, instead of addressing obstructive sleep apnea, because people don't want to use that machine. It's just standing to decorating the bedroom. And I see that, yes, it's a sense of modern fashion, which I don't find fashionable at all.
I don't mean to laugh, but I remember seeing one fairly recently that had dust on it, the machine, and I thought to
That's for
myself,
most of the people,
wow,
they don't
dust
use
was collecting, visible dust, and I'm like, okay.
it.
Let me switch it up to, by the way, we are going to have Dr. Sokolina, all of your YouTube, your sleep apnea, all
Thank
the
you.
links are going to be in the body of the video. So we're going to have
Thank you.
everything for everybody to explore on their own. They can take their time, where to contact you. Let's switch up to, I know you like to tell stories. I've seen you perform. I think you're a bit of an actress. Now tell us about that.
Oh, that's I don't know if yes, I
You're a
do have
writer. I know you're a
I,
writer. You
yes,
write.
thank you. I do have a tons of stories inside of me. I don't know. I think I'm have this lucky charm to attract the stories. Probably because I really like people and they come to me with these stories. And Mike always wonder how come when people come to the dentist, they tell you such an amazing stories while you're working on them. But truth is, very often I'm working on them, but they can still talk. And I listen. But not only through my practice, I encounter a lot of stories just, observing people. Yes, I love the stories and I want to share my stories because I think they evoke compassion and kindness and maybe some romanticism. I really, as I mentioned, I had an education in Soviet Union, so I really like Russian literature. I find it very deep. I find it so beautiful. Uh, I would like to share that, but the way to share those stories, for me, being from another country and have a totally different cultural level, I want to learn how to do it here. So I'm taking classes, and thank you, Lynn, for attending my class show on the storytelling. Now I took improv class, and I'm going to have another opportunity to perform on stage, which make me, from one way, scared, maybe anxious, but from another way, I want to share my stories. I think they're going to make this world better and more beautiful. That's what
Yeah, but
I'm.
also, Dr. Sokolina, it's empowering because when I saw you on the stage, no matter how you might feel on the inside, you were very secure. I thought your delivery very natural, very good. I don't know. I think you have your one woman show is coming. It's going to be there. I
I
see
hope. I
I
hope.
no, I see that. Um let's finish up with what would you like to leave us with today, being that it's International Women's Day? We want to engage, empower, educate our girls, our young women, all women. Give us some final thoughts. What would you like to share with everybody?
I was thinking about that, and I think it's such a dualism of situation. From one point, as a women, we design with all this beauty and ability to have kids and charm the world. From another point, we have to be really since I'm from a different cultural background, and I would say in Soviet Union, it was instilled in us what women have to do. Everything has to be, queen of the house, and then at the same time a good worker. And that was one of the idea. But then system changed, and women become more like a property. Uh, but having those both thoughts in my head when I moved to United States, my word to the women, I really, you have to believe in yourself. I'm sure you have a lot of more power inside than you as a young girl think you have. And another word of wisdom I want to share with you, what not everything in the look. or look is not really, it's important to look good and take care about yourself. Self-love, very important, but I think internal beauty always shine through. And those are the words I would like to share with your listeners. And I want them to believe in yourself. And I think you empower them so much, Lynn. Thank you very much for that. And thank you very much for opportunity for me to connect with your audience. I really appreciate if my channel can help somebody to sleep and breathe better, or if my story, story of somebody who move as adult and build something what she wants, can
Yes.
empower somebody, I would be very happy. So thank you very much for that. I really appreciate this opportunity.
No, I thank you for sharing and also for being such a strong presence and a role model. I consider you a role model for girls and women. And also, you brought up about the beauty. I'm glad you mentioned that because there's such an emphasis on all of that, which is fine. There always has been. But now with the internet, and I am digressing here a little bit, but with the internet and what our young girls are seeing, our youth, our young women, is causing today a lot of, mental health problems. And so it's kind of like the pendulum has gone too far over. We have to start swinging it back. So your message of, beauty on the inside, this is what we have to also stress. In addition to, it's okay to feel good if your hair looks good, but we don't want to have those unrealistic, which is happening on the internet for a lot of teens. They're having such problems, especially today with all of this, comparing themselves. And, it's always, let's be honest, that has always happened with women. But
Absolutely.
I love the idea of, sure, look good, but we have to believe on the inside. We cannot forget about that part. One more thing. What's in the future for you with Harmony Dental Arts? Share with us. What do you have planned there?
Right
You have
now,
beautiful
my
offices. I don't know. I feel like you're going to open a suite of like a spa type environment.
that was an idea for Manhattan office. It's actually look very similar to my New Jersey office. But what I have in mind for Manhattan office, I would like to create like collaborative environment for different specialties in that office. I want to bring different professionals, and we're gonna start with a cosmetologist. We're gonna have a doctor who practice cosmetology, medical doctor aesthetic treatment. But it's only the beginning. I'm inviting different professionals to collaborate in the office on a patient care, because I really think it's going to help a lot of people if we're not going to be so isolated, but we're going to be together. That's regarding Harmony Dental Arts. For me personally, I really would like to put in a book my professional stories, and I think it's going to empower some people who want to do what I'm doing. I think we need more dentists to be involved in dental sleep medicine. I really believe that 87% of people would be enough for all of us to practice dental sleep medicine, and I want to put it in a book. And another thing I really would like to put in a book, my stories, what I, right now I write it for Medium, but I want, to have book connected,
Yeah,
connected stories
connected.
into the book.
Right,
Yeah.
right.
So as of now, those little
Well, that's
plans I
enough for
have in
that's enough for
mind.
now. That's a good game plan. We want to thank you, Dr. Sokolina, for joining us today here on The Warriors. Thank you for the work you do. Thank you for making women and all people just feel comfortable, in your practice. You truly are a warrior. We can't thank you enough. HarmonyDentalArts.com is the website. Again, we're going to have all your other information, the YouTubes, everything, the sleep apnea. It's going to be in the body of the video. And we just want to thank you. I can't say it enough to you for joining us today and teaching us more about the empowerment of dentistry and all you do and sharing your life history. So thank you so much. I'm sure we'll talk again soon because this is just the beginning. We have a lot more to talk about. And happy International Women's Day to you and all the women around you. Thank you, Dr. Sokolina.
Thank you very much, and happy March 8th, International Women's Day. It's a big holiday to empower us. Thank you very much, Lynn, for this opportunity. I really appreciate that.